Hey folks, welcome to the show. It's going to be a great one. Dr. Chris Blevins, equine practitioner, is here. We're going to talk about lameness in horses, and some of the cool things that he's going to talk about is what you can do before you go to that veterinary appointment with your horse to make sure that we get a proper diagnosis, and once we get that, how we can treat it to get your horse better faster.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey folks, welcome to DocTalk. I'm here with Dr. Chris Blevins. He's been on the show a bunch and we're very thankful.
Oh, thank you for having me.
Well, we're thankful for what you do at K-State, what you're doing for the equine world. He's an associate clinical professor here at the Veterinary Health Center, and he is in charge of our equine field service. So if you got a horse, give us a call.
Call us in, yeah.
That's right. We'll come see it. We're going to talk about something that's pretty common, which is lameness.
Yeah.
And I really like some of the notes that you've laid out today because, you know, we tend to just jump into just what are the causes of lameness, but there are some things that you probably need to think about before you just jump to the conclusion, right?
Right. You know, I think whenever you think of a lameness or when you're having a veterinarian potentially come out and look at a lameness is like, well, what is a lameness? You know, and the aspect of that is usually due to pain causing the gait or how they're moving to be abnormal due to pain. There's other things that I think that sometimes it's hard to, differentiate between would be maybe the horse isn't painfully lame, maybe the horse is neurologic or stumbling because the aspect of something else going on, either brain or spinal cord, or maybe it's just the way the horse moves just symmetrically in a different way that maybe some owners just aren't used to looking at. So like gaited horses, that's a whole another realm of how they move, and they just look different than some people maybe are used to seeing.
Yeah, I've had a few neurological, maybe that's neurotic.
Yeah, yeah, right, yeah.
They were off all right. But yeah, and so, so then once you do determine that, hey, there is something wrong, what are some things that they can do to prepare for before you get out there or in communication with you to help get a better diagnosis?
Yeah, I think that some owners and trainers, they can get really frustrated with lamenesses and either frustrated with the lameness itself or frustrated when trying to communicate that with the veterinarian. And I think there's some things that can help relieve some of that or help based on communication. And with technology now, I always, if there's a horse that seems lame by the owner, video it. Video what you're seeing or what you've perceived as the lameness that we can look at, because undoubtedly it never fails. You show up at the clinic and they're not looking the same way as they did when the owner was concerned, or the rider, or the trainer. And so having a video sometimes can be helpful in that communication. So with technology and how easy it is to video anything, that could be really helpful, but even before they even show up. The other thing I think that owners need to remember is we want the animal to be sore during the exam, and so not giving it bute or anything that kind of numbs pain is also going to be important, because we want to be able to see and diagnose and localize where that's at.
Yeah, I think it's that's something that the technology side of things is going to improve our ability, because those horses get into the clinic and they're unfamiliar, they're nervous, and they'll hide because they're a prey species.
Yep.
And they'll hide those clinical signs because of their nerves and their instincts. But let's take a break. When we come back, we're going to talk more about lameness here with Dr. Chris Blevins.
no matter where, no matter why. The Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Chris Blevins, who's fresh out of teaching.
Yeah.
Shaping some young minds, getting them ready for veterinary practice. I tell you what, they don't come much better than this guy sitting next to me, and I'm very, very proud to have him on our faculty here at K-State. And so when we have those horses, there's a couple other things that you wanted to discuss before they bring those horses to you for lameness.
Yeah, and one thing that I think owners also need to remember is that the horse also, the first thing that hits the ground is the foot. And so making sure that they're trimmed appropriately, because just being really long in the foot or, not trimmed appropriately, that can really throw things off too. And so having the farrier out before and make sure everything is ready to go is important. Knowing though that when you show up, shoes may get pulled based on other diagnostics. So we may pull the shoes for radiographs or something like that, but having a really long foot could make it kind of tough to decipher some of that.
Yep. And then it's important what kind of footing. I always show the video for our packing plants and different things on footing for cattle of the difference between a child walking across the lawn versus walking across the driveway with rocks barefoot.
Yeah.
It can make you look lame pretty quick.
Yep, it's the same thing for horses. Big, large boulders, they're going to show different aspects, tripping over that, asphalt, soft footing, and sometimes the lameness is seen more in the soft ground versus hard ground, and so it kind of depends, or vice versa.
Yep. So then when we get them there, so we've gone through the checks, we've made sure that they're trimmed up, we don't have them on bute, we have them in that. What kind of diagnostics are we going to utilize to diagnose lameness?
The first thing is we have to localize where it's at, and so we can do nerve blocks and those things with the horse during that exam to really focus something or our attention onto certain areas. Then after that, there's technology and what we use diagnostically continues to improve, and what we get based on those diagnostics has really improved too. So radiographs or x-rays, obviously that's a big part of it, looking at joints, looking at bone structure. That can be really helpful, picking out arthritis based on radiographs. Ultrasound, looking at the soft tissue, and so that is just amazing, the images that we get now with a lot of the ultrasound machines. The details to be able to decipher some of that stuff is amazing. MRI, so we're, you can put a horse through an MRI. There's, different places that have standing MRIs or anesthetized, and then we'll put the horse through an MRI machine that we'll be having here at Kansas State soon, and then CT. So we can, do CT on their legs or a head on a horse. So that's just amazing, the kind of details we get.
Yeah, it is amazing. And then when you're talking about blocking the feet, it's a little bit different than when we block a foot with cattle. We're not putting a block underneath them. You're actually going to numb the foot going up.
Right, from down the ground and working our way up. So yeah, that's just a numbing agent like lidocaine and those kind of numbing agents.
And so then that will help you if they're lame, and then we block here and they're not lame, then we can, or let's say that we block here and they continue to be lame and we go higher, then you're just ruling out and trying to pinpoint the area of the leg or the foot that is the problem.
Exactly right. So it just helps us figure out where exactly that's coming from.
It's awesome. It's great information, great professor here and clinician at Kansas State University, helping you with your horses, Dr. Chris Blevins.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business is started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we're glad to answer it and work with you.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We're Jurger's Cattle Company, cow-calf operation primarily, with a small replacement heifer operation. We started our operation in 2012, but we expanded on my father-in-law's operation, who started in the 70s, and built off his expertise and his knowledge, and have taken and grown it to what it is today. We span about 4 different counties in North and South Carolina, running about 1,000 acres with 350 roughly head of mama cows. My husband and I and my son and my father-in-law operate together. About 2 years ago, we decided to make the switch to become all-natural producers. And what that means is it's a certain standard of quality and life for not only the calves that become part of the food source and the meat itself, but the cows also. Beef checkoff is important for our operation in a twofold way. First is marketing, creating a customer for us. We sell directly to feedlots, but our end game is the consumer. We want to create a product for the consumer that they desire, that they want to go back to the supermarket or steakhouse and they want more beef. Everybody knows the slogan, beef is what's for dinner, but it falls even more than that in that they've raised consumer awareness in quality, which is important to us because we try to focus heavily on our genetics. That's a main component of our operation, and the checkoff has allowed us to do that by promoting a product that's important to the consumer, that it's good quality, it's safe, it's nutritious, and they're gonna want to be return customers.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hi, I'm Kim Mandring with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Chris Blevins, who is an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine, where he heads up our equine field service and sees a lot of lame cases, specifically with horses. And great information. Proper prep, what you're going to do when they get there. Now, what are some of the main causes that you see of lameness?
Yeah, most lamenesses are caused by the aspects of what they do, what you're making the horse do, and so trauma, whether riding or what they do to themselves. I mean, some horses will traumatize or cause injuries to themselves. Or it could be just constant repetitive motions, just like us. If we get sore in our legs, knees, and wrists or whatever, we're kind of doing the same thing for horses. And so athletic trauma is very common, and so how we handle those is, again, depends on the location. And then conformation, how they actually stand. We start thinking about halter horses and their conformation. That actually has a big part of trying to prevent lamenesses as they go, because if they're loading their legs equally, then we're going to have less potential trauma to those areas as they get older.
Yep. So when they come in, and regardless of the cause, whether it's an injury or whether it's conformation, that will help us with preventing.
Mm-hmm.
But there are different degrees of lameness, right?
Yeah, and so that, you'll hear veterinarians will say, well, that's a grade 3 lameness. But so what that means is there's a grade of lameness based on a 0 to 5 scale. 0, no lameness seen in the horse. 1 is very intermittent lameness, sometimes only seen sporadically in either trotting on a straight surface or in a circle. And then you get to grade 2 and it's more consistent, usually in one way, either on a straight line or in a circle or something like that. Grade 3, consistent, whether going straight or in a circle.
That's a pretty lame horse.
Yeah, pretty lame horse, should be able to see that. Grade 4, you see it at the walk. And so if a horse is that lame or that sore, usually going to see that even at a walk. And then grade 5 is they don't like to put weight on that foot.
So help me then with some of the lamenesses. So talk me through some of the tricks of seeing what you're looking for and what your eye is looking for. If there's someone at home that has a horse, what are some of the tricks or things? We obviously the 3s, the 4s, the 5s, we get it. But
right.
What are some things that I should start cluing my eye in to look at horses?
Yeah, I think it's there's multiple things. Length of stride. If they're going to be sore on a foot, they're going to get off that foot quicker. So sometimes it's going to be a shorter stride length if you're looking on the side of them. The other thing is just watch what they're doing with their hip and their head. If they're asymmetrically moving, they should be bobbing the same, whether walking or trotting, no matter what leg's hitting the ground. But if they start doing something a little off one way versus the other, then that also could be an indicator.
Yeah, the hip would help you with the dip in the hip on the back leg lameness and the head bob on the front leg.
Yep. Sometimes you can have a head bob on the back leg if they're driving their self forward when that leg hits the ground too. But yeah, it's kind of looking at the whole horse. But yeah, focus on the hip and the head are really helpful.
I just remember the down with the sound.
Yeah.
On the head bob. But
yeah.
That's us cow guys. But we have to remember a few of our equine lectures.
Well, I always tell students, just think about a tack in your bottom of your foot. How would you actually take a step? So they're actually, that kind of helps them too. I was like, well, if you don't really understand, let me take a tack.
Yeah, we'll show you.
Yeah.
All right, we're going to take a break here, and we'll come back and we'll wrap up with some of the treatments for lameness with Dr. Chris Blevins.
Are your cows practical or profitable? If you want them to be both, come to the Dale Banks Angus Bull Sale Saturday, November 17th near Eureka, Kansas, selling 140 yearling and coming 2-year-olds who have spent their days on the rugged pastures of the Flint Hills. For 114 years, the Perriers have been focused on providing hard-working, balanced straight bulls for progressive cattlemen nationwide. Make plans to join us November 17th or pre-register to bid online. For more information and to view our catalog, visit www.dalebanks.com.
Thanks for joining me today for Boehringer Ingelheim's Cattle First. When we start to think about labels that are on bottles of antibiotics, it's extremely important that we follow them. The first thing that's on the label, what species is this indicated for? So it might be for cattle, for horses, for dogs, or cats. Once we understand the species that these products are labeled for, what's the indication? Bovine respiratory disease. Could it be for foot rot? There's a list of species, indications. After that, what's the dosage, what's the route of administration, and then what's the withdrawal time, or the time in which it's safe to take an animal to slaughter from the time in which the animal was last treated until that animal was slaughtered. So, species, indication, dosage, route of administration, withdrawal. All of these are important components on the label, so make sure that you follow them and use antibiotics judiciously. Boehringer Ingelheim's Cattle First.
Clyde Sutton, Ness City, Kansas. Lived on this place all my life. About a year and a half ago, got to where I couldn't saddle a horse. The pain was terrible. Read about stem cell. First it wasn't for me, then they started doing neck and back. Went and had it done. As you can see, I saddled a horse. I'm still building fence. Love to shoot a shotgun rifle, and I'm able to participate, not like I used to, but nevertheless I can do the things I used to do, and life is good.
This week is the Tarwater Farm and Home 40th Anniversary and Annual Key Days sale. All Key and Polar King items are on sale. Work is tough, Key is tougher. Bib overalls, insulated overalls, jeans, denim shirts, insulated jackets and coats, and so much more. Enjoy free popcorn and find 40th Anniversary sale savings store-wide. Get your Christmas shopping done early. This week, the 40th Anniversary Key Days sale at Tarwater Farm and Home, 4107 North Topeka Boulevard.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. We're here with Dr. Chris Blevins at Kansas State University, where he serves as the head of our equine field service. He's an associate, tenured clinical professor here at Kansas State University's Veterinary Health Center in the College of Veterinary Medicine. And we've had lame horses, we've diagnosed it. Now we're going to talk about some treatments. What are some things that we'll do with treating a lame horse?
You know, I think that once you get to a horse and you know exactly what you're kind of dealing with, you can do multiple things. The first thing that's very conservative is just rest. And sometimes what our doctors will tell us, you just need to rest it for a while. And so that is sometimes what we'll do for horses, especially soft tissue, to get that to heal up. There are a lot of other things, though, that we can do with the horse. We can take and treat medically, even injecting like steroids and those things in joints to help relieve some of the inflammation and pain, if we know exactly where that's at, or arthritis. There's even injecting some areas of soft tissue with different things. And as we look forward, even regenerative medicine and those things as they go, and that is part of the potential medical treatment that they'll have too. Farriers, we usually get the farriers involved. Again, first thing to hit the ground is the foot, and so we can really help alleviate some pain just based on angulation and trimming and those things, and working with farriers. They're a really important aspect of
So you can do some of the corrective shoeing and protective shoeing.
Yeah.
To take weight off or put weight on or different things like that, can't you?
Right. Especially, you get closer to the ground, so we always hear about navicular disease or heel pain, but a farrier can really help with those things and prevent things from getting worse too, as if we can catch it early.
That's cool. It cracks me up because everything that you're talking about, I've had 3 out of the 4 daughters have ACLs and surgeries, and it all sounds eerily familiar of horses and athletes going through the same things with the steroid injections and some of the regenerative medicine and arthritis and make sure they have their inserts in their basketball shoes so they step right. It's all just the same.
It's the same. We probably learn from both. I think that the aspect of that kind of teamwork is something we'll learn from.
Yeah, and then the last one you have here is surgical.
But, so there's surgeries can be all kinds of places and aspects. It depends on what's going on, but there's aspects of cleaning joints and helping repair soft tissue. So it's unbelievable.
It's great. Well, thanks for being with us today. Thanks for always bringing great information and folks. I hope you enjoy them as much as I do. Remember, if you want to find us at DocTalk, you can find us on the web at www.doctalktv.com. We have archived shows. You can also make sure that you work with your local veterinarian. It's important to all of us to support that local practitioner and that you're working with them. For Dr. Chris Blevins, I'm Dr. Dan Thompson. Thanks for joining us today, and we'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.